Hello, my name is Christian Ocampo. I'll be doing my video validation on hanging an IV piggyback without a pump. To start off, I'm going to read you off the 7 things you should do before doing anything with your patient. We're going to check physician's orders. We're going to identify your patient with 2 markers, so date of birth, name, medical record number. We want to match that with their wristband, so just to be sure. Yep, that's our patient. Okay. We're going to introduce ourselves to the patient. We're going to explain the procedure to our patient. We're going to maintain patient privacy. We're going to also gather all of our equipment, and we're going to end it off by washing our hands. For setting up an IV piggyback, we want to make sure that we compare, we go to our physician's orders and our MAR and check what piggyback is being hung on what primary bag and the rate it's going to be at. In this case, our order is going to be 2 mLs every minute, and with our drip factor of 10 drops every ml, that's 20 drops per minute. On top of that, we also want to make sure we have the correct IV piggyback. Make sure it's not expired. You know, doesn't seem like it. No one's fiddled around with it. We also want to make sure with our primary bag that we remember what the original infusion rate was at, because once we hook up the IV, the piggyback, we're going to have to temporarily stop that primary bag. Next up, we're actually going to assess our patient's IV site. So I'm going to bring my patient up to a working level, and we're going to be assessing for IV line patency. So any abnormalities like infiltration, redness, swelling, infection, all that stuff, we would act accordingly. But since we have a perfectly good line here, we're going to proceed. Okay, so I have my bag and I have my tubing. I'm just gonna open this up real quick. Okay, I got my hanger. I got this. You want to make sure that your secondary tubing is clamped on the roller clamp here. Okay, so I'm gonna now spike the bag real quick and remove spike cap. Going to spike it, flip it around, depress the chamber, get about half. Yeah, that's about half. That's good. Okay. Now, before I prime it, I would also recommend that you put on some sort of like label on the tubing. You know, when you hung it, what time, what day, and if you want, what medication it was. So now we have that. We're gonna now prime it. I'm just actually going to remove this little safety mechanism over here at the cock stop. And with the rolling clamp, I'm actually going to prime it. So, and you want to make sure that you maintain sterility. So this thing over here has to stay above my waist level. I'm just gonna prime it real quick. Okay, it's primed. Just like so. Then we got that. We're going to take our alcohol swab, and at the first white port of the primary bag, I'm just going to quickly hang this momentarily. The first white port over here, we're just going to quickly clean that off. However long you like, I would say 10 seconds. Seems pretty good. Okay. Now while this is still clamped, I'm going to attach it. You know, once it's dry, and it seems dry right now. Hook it up, twist, and make sure that's correct. Now before I unclamp it, I want to make sure my primary bag is going to be lowered. So with our hanger, take the primary bag, hook it up to the hanger, just like so. Now, I'm going to unclamp my piggyback tubing. So that way, this will start flowing. Now with the primary bag, rolling clamp, I'm going to use this to get the proper infusion rate. Since our order is 20 drops per minute, we're aiming for that as our goal. So that roughly translates to 10 drops in 30 seconds, or 1 in every 3. 1 drop every 3 seconds, I'm sorry. So I'm gonna go. 1, 2, 3. 1, 2. Okay, it's a smidge fast. I'm just gonna. One, two, three. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Drop. 1, 2, 3. Drop. 1, 2, 3. Drop. Okay. 1, drop. 1, 2, 3. Drop. 1, 2, 3. Drop. 1.
Stop the video. I would have failed right there. I would have failed right here. Right here.
Okay. So we got our piggyback all set up. So our next step is to wash our hands and bring our patient back down to the lowest level, since we had her originally at working height. So I'm bringing her right back down right now. So we're gonna wait for this to infuse, and once it's done infusing, we're going to clamp our piggyback. All right. You know, let's say this is done. You know, we clamp our piggyback. Our primary goes back up, just like so. We remove our piggyback. You know, discard accordingly. Then we're gonna chart on the MAR, document eyes and O's, and restore our primary bag back to the original way that we found it. So according to the physician's orders prior to the IV piggyback hanging. And that's pretty much it. We're gonna wash our hands. We're going to get our patient safe. So call bell, breaks on the bed at lowest position, ask if our patient needs anything else, and that's it. That's how you do an IV piggyback, guys. Thank you.